Your blood type predicts how you die. The truth about longevity. Let me ask you something a bit uncomfortable. If a medical professional looked at you right now and said, based on your biology, here is the most statistically likely way your body will begin to fail after 60, would you want to know? Most people say yes, and then they spend the next decade ignoring the exact information that could prevent it. It's truly remarkable how often this happens. After years of working in preventive health, a consistent pattern emerges. There's a single piece of data that almost everyone has had since birth. It might be on a faded card in a drawer or a hospital form from years ago, and it's one of the most underused biological indicators we have for predicting age-related disease patterns. I'm talking about your blood type, but not in the way diet books or wellness trends typically present it. Instead, I'm referring to what robust, peer-reviewed epidemiological research, spanning hundreds of thousands of patients tracked over multiple decades, has increasingly shown us. Your blood group leaves a measurable fingerprint on how your cardiovascular system ages, how your brain handles pressure, how your immune system behaves when challenged, and yes, statistically speaking, what is most likely to affect your long-term health if you don't take proactive steps. Today, we're going to dive into every blood type, O, A, B, and AB. For each one, I'll share insights that most doctors rarely have time to discuss in a routine 15-minute appointment. It's not because they're holding back information, but simply because connecting these specific dots takes more time than a typical visit allows. I'm going to do that for you right now. But stick with me until the very end of this video because there's an additional modifier that sits on top of every single blood type, something beyond the simple letter on your card, that significantly changes your personal risk profile. Most people have never even considered it. But for now, before we go any further, do me a quick favor. Drop a comment below and tell me, what's your blood type? O, A, B, or AB? Knowing yours will make what comes next much more relevant and impactful for you. Let's start with type O, and I want to frame this a bit differently than you might have heard before. Type O is the dominant blood type on Earth, carried by roughly 45% of people. For most of human history, this was likely an enormous survival advantage. Type O blood appears to have emerged in our earliest ancestral populations, shaped by environments that demanded physical endurance, a robust immune response to parasitic infection, and a digestive system capable of processing large amounts of animal protein, even under stress. So, what does that ancient blueprint look like inside a modern body after age 60? On the cardiovascular side, type O individuals tend to carry lower circulating levels of von Willebrand factor, a protein involved in clotting. Less clotting activity generally translates into smoother blood flow, less platelet aggregation, and a statistically lower risk of arterial blockages that cause heart attacks and ischemic strokes. Multiple large-scale studies have consistently confirmed that type O individuals have a meaningfully lower risk of coronary artery disease compared to types A, B, and AB combined. That's genuinely good news. But here's something that often isn't told to type O men and women over 50. That cardiovascular advantage can sometimes become a psychological trap. It's a pattern seen time and again. A type O individual in their late 50s comes in. Their blood pressure is fine, cholesterol is manageable, no family history of heart disease. Because they feel inherently protected in this area, they may stop paying close attention to other bodily systems that are quietly eroding. They might ignore fatigue, dismiss digestive complaints, or push through joint pain. This is because type O's most serious age-related vulnerabilities don't come from the heart, they come from below it. The stomach lining of a type O individual expresses surface receptors that the bacterium Helicobacter pylori finds, quite frankly, easier to attach to than those of any other blood type. H. pylori doesn't usually announce itself with intense pain in most people. It moves in silently, colonizes the gastric mucosa, and over years and decades, it gradually breaks down the protective lining of the stomach. If left undetected, this can slowly escalate from chronic gastritis to peptic ulcers, and in a meaningful percentage of cases, to gastric cancer. And unfortunately, gastric cancer caught late can be one of the more difficult cancers to treat successfully. There's also evidence that type O individuals show a measurably elevated risk for certain peptic ulcer complications that require surgical intervention compared to other blood types. This isn't theory, it's well documented. So, if you are type O and over 55 and have never been tested for H. pylori, That is the single most important conversation to have with your doctor this year. It's a simple stool antigen test or a breath test, and it's inexpensive. For type O individuals, this isn't just routine caution. It's targeted prevention based on your specific biology. Here is your type O protocol for longevity. Your gut is your primary vulnerability, so protect it actively and consistently. That means limiting the long-term use of non-steroidal anti-inflammatory drugs like ibuprofen and aspirin unless medically necessary. These drugs erode gastric lining in everyone, but in type O individuals, they impact tissue that is already at higher biological risk. Incorporate fermented foods into your regular eating pattern: kefir, miso, kimchi, naturally fermented pickles. These aren't just trendy extras. For type O, they are a practical tool for maintaining a gastric environment that is more resistant to bacterial colonization. And physically, your body was truly built for movement. Type O blood is associated with higher baseline catecholamine activity, meaning your nervous system runs on more dopamine and norepinephrine than other blood types. When that energy has no physical outlet, it can convert into restlessness, disrupted sleep, and over time, cortisol dysregulation. Just 30 minutes of daily walking and 2 sessions of resistance training per week will do more for your long-term metabolic health than any supplement stack. Type O, cardiovascular strength is your inheritance. Your stomach is your responsibility. Do not let the first make you complacent about the second. Before we continue, let me know where you're watching from. Knowing more about our community helps immensely. Now let's talk about type A. I want you to lean in here, because this is a blood type where the gap between what people know and what they should know is often the widest. Type A emerged as human populations transitioned toward agricultural living, which meant denser settlements, more complex social environments, and exposure to a broader range of infectious agents. The immune system adapted. Type A individuals typically mount aggressive and effective immune responses, particularly against viral pathogens. In younger years, that's a genuine biological asset. But this is where the blood type story gets complicated, because what protects you effectively in your 30s and 40s can begin to work against you in different ways by your 60s. Type A blood carries higher coagulation activity. The platelets are stickier, and the clotting proteins are more active. A landmark study tracking nearly 90,000 adults over 20 years found that type A individuals carry a 5% elevated risk of coronary heart disease compared to type O. That 5% might sound modest in isolation, but here's what makes it clinically significant for type A specifically. When you layer chronically elevated cortisol on top of that stickier platelet activity, the compounding effect over decades is what turns a 5% statistical difference into a real cardiovascular event. The risk isn't just in the number. It's in what your stress biology does to that number every single day. Now here's the layer that most discussions miss entirely. The reason that risk is so significant isn't just mechanical, it's hormonal. Type A individuals tend to maintain the highest baseline cortisol levels of any blood type. Cortisol is your primary stress hormone, and in short bursts, it's incredibly useful. It sharpens focus, mobilizes glucose, and prepares the body to handle a challenge. But when cortisol runs chronically elevated, week after week, month after month, it does something very specific to your arterial health. It inflames and stiffens the endothelium, the thin inner lining of your blood vessels. And here is the mechanism that should concern every type A individual watching this. When your endothelium is inflamed and less elastic, it becomes a surface that sticky platelets preferentially adhere to. The elevated coagulation activity of type A blood and the chronic cortisol-driven endothelial inflammation of type A physiology are not two separate risk factors. They are a compounding cycle. Each one makes the other more dangerous. What this means practically is that for type A individuals, stress management isn't a wellness preference. It's direct cardiovascular medicine. It belongs in the same category as blood pressure medication and cholesterol management, because physiologically it is addressing the same underlying pathway. If you are type A and over 55, monitoring your blood pressure readings every 6 months rather than annually isn't overcautious. It's appropriate clinical monitoring for your specific biology. Ask your doctor to include homocysteine in your next blood panel. Homocysteine is an amino acid that, when elevated, actively damages arterial walls. Type A individuals often trend toward higher homocysteine levels, and the intervention is remarkably simple. Adequate folate, B12, and B6 found in dark leafy greens, eggs, legumes, and lean proteins. This isn't expensive or complicated, but it is specific to your needs. And build a daily cortisol reset practice, not a weekend retreat, not an occasional meditation session, but something you do every single morning before the day gets its hands on you. Diaphragmatic breathing, 4 seconds in and 6 seconds out, practiced for 10 minutes consistently, has measurable effects on cortisol regulation in clinical studies. The consistency matters far more than the duration. 5 minutes every morning outperforms an hour on Sunday by a significant margin. Type A. You have powerful immune resilience, but also an elevated cardiovascular risk driven by a stress hormone that your blood type keeps chronically elevated. Managing that hormone is one of the most important health decisions you will make this decade. If you're still here with me and finding this helpful, take a moment to type A in the comments. It lets me know you're watching and getting value from this. Next, let's discuss type B. This is a blood type that often feels misunderstood by conventional medicine and often mishandled by mainstream wellness culture. Type B emerged among nomadic populations moving across the vast interior of Central Asia and the Himalayas. These were people constantly adapting to new food environments, new climates, and new infectious pressures. The immune system that developed is truly remarkable in its metabolic flexibility. Type B individuals can efficiently process a wide